Hi, my name is Yasu, and in my channel I do Hitorigoto. It's a Japanese word and it means talking to myself. So I'm here by myself talking to my camera and talk about my life, I guess, things that happen in my life and so on. And then sometimes I answer question that's given to me on the comment section, in the comment section for the videos that I post. And today I want to answer one of the questions, which is what made you take that antidepressant? And that antidepressant means Effexor and venlafaxine. And when I saw the question, it really brought me back to like 2 years ago in July 2023, which was the month that I got completely, like, psychologically, mentally deteriorated. I couldn't function. I didn't know what was going on. I feel like I am like diffusing. Like I cannot keep my spirits intact. Like, how do I say? Like, um, it's basically completely out of control, and I don't even know how to connect myself with myself. And I was completely lost, and it was really the darkest moment ever. Complete lost, and I don't wanna actually experience that anymore again because I'm just really scared. So the conclusion and answer to the question is very simple actually, because my psychiatrist recommended me to take in the Effexor, nothing else but Effexor, and I just listened and follow his advice, and then basically that's it. That's how I started to take in Effexor and venlafaxine. And I didn't question my doctor, and I didn't really even question and think about much about me taking Effexor because I was already on the edge. I just didn't know what to do. I couldn't make any decisions on my own. And then because it was really my first time to take antidepressant, so I don't know what Effexor was or what it would do to me. Even my doctor explained. I remember like he was telling me that this is going to help you to stabilize your mood swing, and also uh, most likely it's going to help you to restore your energy level and then so on. I think that's the only thing that he told me, and he also explained about the side effects and everything. But because I had no information about any other antidepressants, I didn't nothing else really came to my mind, like, oh, instead of Effexor, what if I take Prozac or any kind of other antidepressants, because I didn't know anything at all. And looking back, I think I was lucky enough to be introduced to Effexor because I've seen many people who struggle to find suitable medications that would actually work on their conditions. So they try one antidepressant and like see how it goes for like a few months or couple months, and then only realize that it's not that effective, and then they change the medication to something else, and then try it for like couple months or a few months, and then they just either keep changing or eventually they find the one that's suitable for themselves. But they have to go, a lot of people go through that try and error, and it's very painful and then hopeless process to go through, especially when people are suffering from the mental health issues. In my case, I was lucky enough to be introduced to Effexor, and then lucky enough that Effexor was very effective. Of course, I suffered from the side effects and everything, but it really helped me to stabilize my mood swing. And then as soon as I increase the amount of it to the highest dose, it really restored my energy level. So I didn't have to change Effexor. It was very much like textbook procedures, and also how my body reacted to it. So when I increased the doses, of course I suffered from side effects and so on, but mood swing got more stabilized. Once I start taking the highest dose of it, I restored the energy level, and then kept the highest dose for like I think nearly 6 months. And once everything is pretty much stabilized, like I take the medications, but I don't feel like I'm treating my depressions. That was the cue that maybe time for me to reduce the amount of the medications, which I did. When I reduced it, of course, I suffer from the withdrawal symptoms, but giving myself a week or 10 days or so, it got stabilized again, and then keep repeating the same cycle, and then stop taking it completely, and then goes through the same cycle. And then now I am where I am right now. I don't take the Effexor anymore. I think I really managed to get through the hardest time of the withdrawal symptoms caused by the state that I don't take Effexor anymore, which I talked about in different videos. So it's very, very textbook scenario for me when it comes to antidepressant. And I think it's just luck. Or maybe I can say that my psychiatrist really paid attention to me, assessed me, and then made a very suitable recommendations to me. And at the same time, my psychiatrist was really trying to stabilize any side effects that I experienced. And that is why overall, at some point, I was able to have all of the side effects caused by Effexor under control to really get through everything. And having said that, I was really struggling with my sleep issues. I think caused by Effexor. Because Effexor was effective from the first day I started taking it, all of my focus was actually on my sleep issues, because no matter what I tried, I couldn't sleep. And every month, I came back to the doctor telling doctors that it didn't work. I'm miserable. And then my doctor recommended that, okay, let's try this sleeping pill. I tried it for another 1 month, came back to the doctor and saying that it didn't work. And the doctor suggested that let's try this one this time. And I tried it for like a month, and it came back and telling him that it didn't work. It's a very tiring process to go through, very exhausting, very hopeless. There was a time that I was really giving up. I feel like I'm gonna give up on this. It's just not being able to sleep. It's just killing me so much. And then I tried, but nothing worked out. It's just such a painful process to go through. But in the end, after probably 7 months or so, I finally encounter the combination of the sleeping pill that really puts me in sleep, which is the hallucination, no, which is halcyon and then nitrazepam. And afterwards, I got more comfortable, and one way or another, and at some level, my sleep issue becomes manageable. So looking back, even speaking of like for me, going through all of the depression treatment, it's more like treating my sleep disorders rather than the depressions. That's only because I was lucky enough to encounter Effexor at the beginning. And I decided to take the Effexor without thinking much, because my brain, I couldn't think anything back then. And I didn't know anything about antidepressants. I just simply listened to my doctor. But I really do understand how difficult it is to figure out which antidepressants can be effective on your case, because in some way, in a similar way, I was very struggling and going through the same process to figure out what sleeping pill could be effective on me. And it was a long journey. There's a lot of times that I wanted to give up. But in the end, I managed to get to the answer. I really don't want to go back and experience and then go through the same process. I really don't want to do that, and I don't think I can do that anymore. So yeah, I think the question was given to me because the person who gave me the question might be struggling to figure out which antidepressants might be suitable for him or her. And unfortunately, I don't really have the answer, because based on what I'm talking about here, it was luck that I encountered Effexor. It was luck that it was effective on me. It was luck that my doctor recommended it to me. But if we focus on the doctor side, maybe he was able to see more clearly, because he's a doctor. He's trained to assess patient like me, to come up with solutions tailor-made for me. So maybe he was able to see something that I couldn't really see, and that is why he recommended me to take the Effexor. I want to believe in that, and that's really one of the reasons why we work with our doctors to treat a lot of health issues. So I guess what I can say here is that please talk to your doctor. Make sure that you build up the relationship with your doctor and you can really trust your doctor, and then try to do the recommended treatment with your doctors to see how it goes. Your doctor might be able to lead you to a better path to get recovered quickly and then well. But at the same time, your doctor might not be able to have all of the answers for your situations. Just like my doctor couldn't figure out which combination of the sleeping pill would be effective on my case. Luckily for me, he was able to introduce the Effexor to me at the initial stage for the for the depression treatment, but for the sleeping issues, he couldn't. So it I think the luck plays a huge role of it, and at the same time, it's too much for anyone to ask one doctor to give us all of the right answers and directions at the right timing precisely, because no one has that kind of ability and capacity. So yeah, I remember a lot of things. Everything was trial and errors. Going back, asking for some changes, try it. It didn't work. It worked. It's such a painful process. So if you are in the process right now, I can really feel you, and I'm really hoping that you'll be able to find right treatments sooner or later. Yeah, so the conclusion of this video is please really talk to your doctor and then take the treatment once you feel comfortable with, because I had no choice but start taking the Effexor. And I don't think anybody should be in that positions to start the treatment. Everything should be more informative and making informative decisions. But to do so, we need to have a better mental health and a capacity to have conversations with our doctors to begin with and get ready for any kind of treatment. So, yeah, please take care of your health. I think that's all. Thank you for watching. じゃあね。バイバイ。